Hi guys, in this video I want to share with you some spinal range of motion stretches. These stretches are very important to improve your range of motion in your neck and in your back, but it's also very important to improve the health of all of your joints. For your joints to be healthy, they have to have full range of motion. So one thing we're going to do is we're going to start to get into a habit of taking our joints through a full range of motion. That way, as we continue to age, we're not going to get all bound up and tight and locked up where we just can't move anymore. We see that happen on a regular basis. And even for people in their younger years, this is very important to keep you agile and mobile so that you can perform and function, do all the things that you want to do. Another very important thing that this will do is it's going to help to stimulate your nervous system. There's a type of a stimulation called proprioception, and that's the nerve. You have nerves going through every part of your entire body, especially around your spine. All around your spine, there's a very high density of nerves in all the muscles and the ligaments and the tendons. And so every time you move your body, you stimulate those nerves. You fire those nerves off. And what happens is that firing, so if I move my hands, that firing, I stimulate the nerves when I move. That stimulation comes up the nerve, up the spinal cord, and it comes up to my brain. It tells my brain where my hand is in space. And it's very important for your brain to understand that. That way it can send information back down and control your fine motor movements, whether you're playing piano, whether you're typing, whatever it is you're doing with your hands. So it's very important that we be able to control our fine motor movement and our coordination within our spine. That way we're less likely to injure your spine, injure your body. So what we're going to do is we're going to go through a full range of motion. We're going to go both directions. And when you do it, you're going to go as far as you can go, and you're going to hold it for 10 to 15 seconds. Hold it, and while you're holding it, I want you to actually continue to breathe. Focus on your breathing. I would do this on a very regular basis. If you're doing things like yoga, you're not going to need to do this as often because yoga it really does full range of motion stretches for your spine and for other joints in your body too, which is a wonderful thing for you to do. But if you're not doing yoga, this is something you can do that's 5 to 10 minutes or less that you can do on a regular basis. And when I say regular basis, either daily or 3 to 4 times a week. That's a good goal to shoot for. So here's how it goes. What we're going to do is we're going to do rotation. We're going to turn. So we're going to turn to the right, turn to the left. We're going to do lateral flexion, which is bending to the right and bending to the left. And then we're also going to do forward flexion, bending forward, and then extension, we're looking up and back. So we're going to do that with our neck. We're going to do that with our low back. When I do rotation and when I do lateral flexion, I like to do those with full spine. When I'm doing bending forward and extending back, I like to do those separate with the neck and the back after that. So here's how it goes. We're going to do rotation first. We're going to turn as far as you can to the right, and then you're going to take the rest of your spine with you. Go as far as you can, hold it for about 10 to 15 seconds. Continue to breathe. Now, just for sake of time for the video, I'm not going to do the full. I'm not going to hold it for the full amount of time, but hold it for about 10 to 15 seconds and breathe. If you're having any difficulty with any of these movements at all, stop. You need to let us know in the office. That way we can make sure we can restore the motion in those joints. That's what the chiropractic adjustment does, is it helps to restore the proper movement to all the joints in your spine. So let me know if you're having difficulty with these and we can help you with that. Then we're going to go to the left. Again, go as far as you can. Hold it for about 10 to 15 seconds. After you've been there for about 5 seconds and you're breathing through it, see if you can go a little bit further on the next 5 to 10 seconds. That's going to continue to improve the range of motion, improve the elasticity of all of your ligaments and joints. After we do rotation, we then want to go ahead and do lateral flexion. So what you do is you take your head over as far as you can go. I like to bring my arm up. So I bring my arm up and I bend over as far as I can go. I reach down the side of my leg, bend over as far as I can go. And I'll go down and I'll hold that for 10 to 15 seconds. Breathing, expanding the ribs out to get some good expansion, good motion in the ribs. And then I like to go off to the left side as well. So go as far as you can to the left, hold that. This one's a really good stretch down the side of the neck, really good stretch down the side of your body, into your obliques, into your lats as well. So we did rotation, we did lateral flexion. Now what we do is I'll separate the neck and the back with forward flexion. So a lot of times I'll actually lace my fingers, bring my head down, hold that position. if you're doing this and if you have headaches and you get a lot of tension right at the base of your skull here, what you can do is you can bend forward and then tip to this side and then tip to the other side, just like that. That'll help you really isolate those muscles to loosen them up. So then I'll go backwards, so I'll turn to the side here. Go as far as you can backwards. You get a really good stretch in the front of the neck. And then we're going to do the same thing for your low back. So I put my hands in the small of my low back, and I'll bend backwards. Good, and then I'll also bend forward to touch my toes. I'll be out of the picture here so you understand that one. Just bend forward, go as far as you can go. Hold that for 10 to 15 seconds. Again, the benefits of this, if you do this on a regular basis, you're going to improve the function of your joints. Every single joint has to have good motion. You're going to improve the neurology. This is going to help improve that proprioceptive stimulation, which will help with your coordination, your balance. It's going to help prevent a lot of injuries and problems down the road. And again, if you have any trouble or any difficulty with this, just let us know in the office. What we'll do is we'll make sure we can help you restore that motion back with the adjustments. That way you stay agile, you stay mobile for the rest of your life. Hope this helps. Have a good day. We'll see you in the next video.